Hello, I'm Dr. X, a doctor working here today. May I confirm your name and age, please?
Hi, doctor. My name is Angelina Jolie and I am 65 years.
Okay, how may I address you?
You can call me Angelina.
Okay, Mrs. Angelina. Today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay, during our conversation, I might take this down some notes, which will be strictly confidential. Is it okay?
Okay, doctor.
Okay, well, can you please tell me in your own term words what have brought you here today?
This is for the last 1 month. I have some pain on my back, on the middle of my back. Uh, that is somewhat initially I didn't got any injury or anything. One day morning, I noticed that I have some pain on my back. I thought that it was due to my bed sleeping posture, so I didn't pay attention to it. But the pain is increasing day by day, and even now it has got so much severe that I even cannot move properly due to this pain. First, I visited my GP. He thought that this was my somewhat called my bed posture habit, so he advised some ibuprofen tablet, but that is not helping me much. And even now, I cannot. I told you that I cannot move properly, and especially at night, the pain is sometimes so severe that I cannot even sleep at night. So I visited again my GP, and he thought that it might be related to my uh, family problem because my mother had some problem with her bone minerals, and for that she also had a fracture on his spine, and my GP also thinks that I might have that condition.
Okay. Well, we will try our level best to find out what's troubling you. Well, may I know that where did this pain come along suddenly or gradually?
Suddenly, doctor, but it is increasing gradually.
It's increasing gradually. Okay. And well, can you please tell that for how long did it persist for the first time?
After the start, it usually persists almost all the time.
All the time. Okay. Well, do you think that is there any a relation with your workload that if you work, is it increases or decreases, something like that?
Yes, doctor. If I do anything, do any work, then this also increases the pain.
Okay. Well, what happens when you take rest or when you sleep at night
I
after
told
waking
you
up?
that
How do you feel?
I cannot sleep at night properly due to this pain.
Okay. Okay. Have you ever felt that whether there is any morning jamming present or not?
The pain present all the time, doctor, even in the
Okay.
morning.
Okay. That's all right. Yeah. Yeah. Well, can you please describe the pain for me?
Pain is some dull, just aching pain.
Dull pain. Okay. Well, is it just in your back or does it spread to any other place, any other
No,
space? Just your back. Okay. And okay. And well, can you tell me that do you have any pain in your legs?
no,
Okay, that's all
I
right.
think
And
some
can you please?
weakness, doctor.
Sorry, please.
I think some weakness on my legs.
Some weakness on your legs. Okay. And do you have some funny sensation
Yes,
in your
doctor.
leg or in?
Yes,
Yeah, yeah.
doctor. That is when I use commode, I feel those words.
Okay. Any funny sensation in your private parts? Can you feel?
No,
Okay, that's all right. And any numbness in your legs or in that area?
sometimes.
Okay, and can you please tell me that how about your water work?
It's fine, doctor.
Okay, and your bowel movement?
I am little constipated, doctor. I usually that's for last maybe my last for 3 to 4 months. Sometimes I pass my bowel every 2 days or 3 days. This wasn't like before because Previously, I passed my bowel usually every day.
Okay. And now you don't pass.
Yes, doctor.
For how long?
For 3 to 4 months.
3 to 4 months.
Yes.
Okay. That's all right. May I know that how severe is the pain? If I say that 0 is no pain at all, and 10 is the highest pain that you can feel, then how will you grade it?
I would tell it it is 6 to 7, doctor. It is not so much pain, but it is present always and boring and make me
Yeah, yeah.
keep me awake at night. That is very much
Okay,
painful
okay.
for
And
me.
yeah. I think I can get it. Well, can you please tell me that do you do you have any uh, did you have any trauma in your back recently?
Not just trauma, just I some things that I can only remember that I when I was climbing down on stairs, I slept. I missed one stair just. At that time, I
Okay,
thought that there is some uneasy. I felt somewhat uneasy, nothing more significant.
okay. Well, when did that occur?
About 1.5 months back.
1.5 months back. Okay, that's all right. Did you feel any pain, back pain at that time?
No,
Okay, that's all right. Did you have any raised temperature recently?
no,
Okay, any chest infection?
no,
Okay. I'm going to ask you some other questions. Do you have any headache?
no,
Okay. Any changes in your vision?
no,
Okay. Any soreness in your mouth?
no,
Any joint pain? Other joint pain than your back pain?
no,
Any rashes in your skin?
no,
Okay. Can you tell me that do you have any weather preferences recently?
no, no.
Okay. Any changes in your weight?
I lost a little bit weight, doctor. I lost about 3 kg over the last 2 months.
Okay. Is it intentional or unintentional?
Unintentional, doctor. Totally unintentional. I told
Okay.
you
Okay.
I feel constipated, so I
Yeah.
usually I try to take less food.
Okay.
That maybe
Okay. Okay, that's I get it. And okay. And can you please tell me that do you have any racing and pacing of your heart?
no.
Okay. Any chest pain?
Sometimes I feel some pain on my chest, on my right side of my chest, for a couple of months.
Okay. Can you please describe the pain for me?
This is nothing significant, nothing serious, some dull pain.
Okay. That's all right. And okay. And is it better or worse with anything? Can you describe?
Some coughing or sneezing, sometimes bending forward makes it worse.
Okay. Okay. And do you have any shortness of breath?
Not usually, but when I do any work, I feel somewhat shortness of breath.
For how long?
It is also for last 3 or 4 months.
3 or 4 months. Can you please tell me that do you have any difficulty in your hearing?
No,
Okay. And any tightness in your chest?
no,
Okay. Any noisy chest?
no.
Okay. May I ask you some questions? Do you have any other known previous medical condition?
Yes, doctor. I had diagnosed with breast cancer about 5 years ago, and after that, I needed a surgery for that, and they cut it down to remove the tumor, and after that, I needed some medication and also some radiotherapy.
Okay. When was that?
Five
When
years,
was the last
five,
course of
5 years.
drug? Okay.
That
And
case
since
of
then
that
you have been free.
Doctor said that there is no problem. I was on regular follow-up, but for last 3 years, I didn't feel any problem, so I didn't visit the doctor regularly.
Okay, so for the last 3 years, you haven't visited the doctor. Am I right?
Yes.
Well, you told that you had some breast cancer. Well, can you feel that is there any lump and bump again in your breast region? I'm sorry to ask. It's a private question, but can
No.
you have you
No.
noticed?
No. No.
Okay, okay, that's all right. And do you take any other medication? You told that you were prescribed some ibuprofen. Uh,
No.
uh,
No other medication.
okay, okay. Can you please tell me that how many drugs usually take ibuprofen regularly? How many?
2 tablets, doctor. One in the morning and one in the evening.
Okay, okay. Are you allergic to any medication?
No.
Any herbal medication?
No.
Any over-the-counter medication?
No.
Yes. I'm sorry to ask you another question. That do you take any medication by your blood channels?
No. Never.
Okay, that's all right. And may I ask that you told that your mother was a patient of also some bone disease. Do you have any other significant family history?
No.
Any long known disease conditions?
No.
Okay. And may I ask you some personal questions again? Do you smoke?
Yes, doctor.
How many sticks for how long?
About 10 sticks per day for about 40 years.
Okay. Well, actually, it's a very dangerous thing, and it can add to your troubles. And I think it's better if you quit it. And I can refer you to the smoking cessation clinic. Is that all right?
Okay, doctor.
Do you drink alcohol?
No.
Okay. And may I ask you that what do you do for a living?
I was a school teacher, but now I am retired.
Okay.
Previously,
May I know who? Okay. Okay. May I know whom do you live with?
living with my husband and my children.
Well, where do you live? In an apartment or in a house?
It is a apartment.
Okay. Do you have to use stairs?
Yes, doctor. So I usually don't visit the
Yeah,
doctor
yeah.
frequently because I have to use the stairs. There is no lift.
Okay, okay, I get it. And actually, we will. Okay, and is there any railing beside the stairs, or is it open?
Really?
Okay. However, we will inform the social services regarding this issue so that they can take some safety measures. Well, may I know that has there been any recent travel history to any other country?
No.
Do you have any known history of a TB contact? Have you known any?
No.
Okay, and I'm very very sorry to ask that. Well, that may I ask that it's very personal question, but may I ask that do you have any other uh, casual relationships?
Doctor, never.
Okay, okay. I'm very sorry to ask Mrs. Angelina. Okay, and may I know what your concerns are, Mrs. Angelina?
Doctor, I am having this type of bone problem that my mother had.
Well, at this moment, we will have to examine you properly and assess you, and later after that, we can get to you again and explain you more properly. However, as long as I have taken the history, I think that there might be some possibilities. So one is that I'm sorry to say that uh, you have some history of weight loss, and also you haven't been under constant supervision after your chemo and radiotherapy. Okay, so there is a chance, however, that uh, this cancer has come again. Okay, or this cancer has not gone away completely. So, and sometimes this cancer can go to the bones. So this can be a possibility. I cannot rule it out totally. And again, that since you have told that you just went down 1 to 2 steps and then you felt some discomfort, and also that you have been a smoker for a long time and having some night pain, I think that it's also possible that you might be having some problems with your bone minerals. I cannot rule that also, but however, we will involve the joint doctor, and also we will involve our consultant, and they will run some blood tests and also some scanning tests, and they can also, which can also involve some mineral test, okay, of your bones. So after doing all these tests, I think they will be able to map out a better plan for you. Are you getting me?
Yes, doctor.
Do you have any more concerns or questions?
Do I need admission?
Well, I think I will inform my consultant, and I think they will decide upon it. But we might decide to keep you under observation until we run some tests. But we will inform the consultant, and again convey his opinion to you. Are you getting me?
Okay, doctor.
Any more concerns?
No, thank you.
Okay, thank you.
So, what are the differentials do you have?
Well, I think it's a mechanical bone pain, mechanical back pain. The most likely cause, there can be actually some probabilities. I think it can be due to osteoporosis, and also it can be uh, due to his metastasis from his previous breast cancer, since she has not been under regular follow-up. I think these are the main DDs here, diagnosis.
What do you mean by mechanical back pain?
Well, I think it's more after doing some work, this pain, and this doesn't go away after taking some rest. So I think it's mechanical pain.
Can you tell me the difference between the mechanical and pathological back pain?
Uh, well, I'm sorry, I cannot tell it properly.
Okay, no problem. So, how will you investigate her?
Well, actually, I have to at first do some routine blood tests like CBC, ESR, CRP. Then I will have to go for serum electrolyte, creatinine, then some her thyroid profile, liver function, and then at the beginning I will have to do X-ray, plain X-ray back, specifically lumbosacral spine, and after consulting with the rheumatologist, we might take a decision whether MRI of her lumbosacral spine should be done or not. And also, we might go for a bone mineral density scan, BMD scanning.
Okay. What blood minerals do you like to assess?
Well, here I would like to do calcium, serum phosphate, and alkaline phosphatase level.
Okay. Suppose everything is raised. Serum alkaline phosphatase, serum calcium, serum phosphate. What could be the diagnosis at that point?
All raised.
Yes.
I think it can be metastasis.
Okay. And how will you manage her if it is a case of metastatic bone disease?
Okay, actually, we will have to form a multidisciplinary team in this case with the rheumatologist, orthopedic surgeon, physiotherapist, occupational health service. No, sorry, not occupational health service, social services. They will actually at first check out the test results, and then actually they might go on if it is metastatic. I think they might go on for some bone protecting medication like alendronic acid or zoledronic acid, like that, and also calcium. Regarding after getting the test results, some calcium, vitamin D, and also the oncologist. We have to refer to the oncologist to find out whether our cancer is back again or whether it's causing the problem. Then the oncologist might uh, go to that cancer treatment also.
Whatever the oncologist will do, that is their decision, not your decision. So you that involve
Sorry.
you think that involvement of rheumatologist is necessary. What will be the role of rheumatologist in this case?
Well, I'm not sure. I think orthopedic surgeon will also be important.
Okay, so involvement of the orthopedic surgeon and involvement of the oncologist. That would be enough
Yes.
initially, I think.
Okay. Okay.
Okay, in the history taking, I want to point some notes that your everything was fine.
Okay.
So for back pain, you should have asked more precisely that can you show me the site, or can you tell me exactly what is the site of your pain? Where do you feel the pain?
Yeah.
You said that
Yeah.
she needs lumbosacral spine X-ray, but actually this patient had pain on his thoracic region. You haven't asked it properly.
Mm.
Once
Mm.
onset, that was fine. Before
Okay.
what happened before the onset,
Yeah. I
spinal
actually
as
muted- I actually misheard. I actually heard that lower back or something like that. I just couldn't remember. That's why
even
I
your
actually
lower back.
misheard.
What do you mean by lower back? What is the site? Can you show me? It can be coccyx,
Okay.
it can be
Okay.
lumbar, it can be
Yeah. 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 Okay. So actually, that was a wrongdoing from my side.
yes. And character of the spine, that was fine. Radiation, I cannot remember if you have asked.
Yeah. Yeah. I asked radiation. You told no radiation, but
Yes.
then I went whether any leg pain or
And then
involvement or not.
associated symptoms for pain associated, any signs of inflammation. That is, have you noticed any lumps or any
Mm-hmm.
swelling, any uh, raised
Mm-hmm.
temperature over the area?
Mm-hmm. Mm-hmm.
Okay,
Mm-hmm.
redness over the area,
Mm-hmm.
and with associated neurological problem of his limbs, sensory and
Yeah.
motor. Yes,
Mhm.
you have asked, and also sensory, and also
Mm.
motor symptoms of her
Mm. Yeah.
private parts, a bowel bladder.
Yeah.
You asked, that was well. And for her associated symptoms, it can be due to trauma, any history of trauma, and for
Mm.
metastasis, you will find it later that what are the signs of metastasis, and associated with
Mm.
weight loss, anorexia, nausea, vomiting.
Mm.
Okay.
Yeah. I asked those. I think.
Yes, yes, you have asked.
Mhm. Mhm.
And for timing, timing is very
Mm.
important because nighttime pain is also
Yeah.
a,
Yeah. Actually, you yourself asked. These are the alarming symptoms: night pain, thoracic pain,
yeah,
weight loss.
yeah.
Yeah. So I think these are
This
very important
patient has,
neurological involvement.
yes,
Yeah. Yeah.
patient has all those.
Yeah. Yeah.
Eliciting factor, as far as I remember, you haven't asked about that. Have you noticed anything that makes your pain worse or better?
Yeah. Yeah. I asked. I asked. Anything makes course or better.
Okay, I cannot remember
Yeah. 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 I
because
asked that whether you
movement
rest or
or
any work.
movement forward bending and sometimes coughing makes this
Mm-hmm.
pain worse.
Mm-hmm.
I can remember that you have asked about the numbing, what makes your numbing worse or better.
Actually asked not in this way. I asked that whether any rest or any work makes it feel worse or better. I think I used that language, but I should have asked like this: any movement forward bending or coughing. I should have asked in this way.
Okay. And severity, you have asked that how much severe and severity scale. Okay, and associated symptoms, that is, and also systemic symptoms was fine. Do not remember if you have asked about any cough. This patient have,
Yeah, I asked. I think.
I cannot remember.
Oh, okay, okay. I might have missed. So did he have cough?
Yes, I have had some cough and systemic.
Okay. Yeah, yeah. Okay.
Okay,
Okay.
otherwise, and in the family and for these patients, period of also was an important because for osteoporosis, period is an important factor. It was what age? her period
Mhm.
stopped. Okay,
Okay.
and also dietary habit.
Mm. Yeah. Yeah.
Otherwise, everything was fine. You have covered everything else. Sometimes sunlight exposure, that is also an important factor.
Okay.
Okay,
Okay. Yeah.
okay,
Well, what was the case actually?
okay. It is a metastatic bone fracture.
Metastatic bone fracture, and you actually there was some differences between my opinion and your opinion. What should have I told? Is this mechanical bone pain, back pain, or what?
Mechanical pain is something like that usually go away with taking rest. There is no signs of inflammation and
Mm.
pressure or some strenuous activity brings that pain.
Mm-hmm. Mm.
And for this lady, there was resting pain also. And movement always, where there is a pathological fracture, always movement will bring the pain. That is not a mechanical back pain.
Oh, sorry. What? Always movement?
Movement will bring pain on any fracture bone. It is not a mechanical pain.
Yeah. Mm-hmm. Mm-hmm. Okay.
Okay, everything was fine. Okay, thank you.
And and okay. Okay. So okay. Thank you.